Okay, here we are in week 4. We're going to look at the second part of the second half of the chapter in abnormal psychology, looking at anxiety, obsessive compulsive disorders, and stress-related disorders. And we're going to look at here is treatments. And as I mentioned in the previous video, that as much as treatments are important, there isn't any one that fits all people. Now remember, in terms of classifications, that's done dimensionally in the DSM-5, which really just means it's on a continuum. And so you can imagine, I hope, that if someone is at this end and somebody else is here, that the treatment for each of these might be different. And therefore, it's important to pay attention that when we look at treatments, there isn't a one-size-fits-all. It will be on a criteria of, in part, theoretical basis and the practitioner that's helping somebody and their theoretical background, and therefore the choice of medications or the choice of treatment. And so a lot of times it's done in combination with one another because it's helpful for that individual to do a combination, whereas for somebody else they might do one or another. All right, so I hope you find this particular video helpful too, and carry on the good hard work, and make sure that you have your textbook and your notes preparing, so when you do the test, you have resources available to help you. All right, good luck everybody. Carry on. So we'll start with the treatment that the psychodynamic group looks at. Now, treatment for anxiety disorders. Now, each theoretical perspective is connected with methods of treating anxiety disorder, and traditional psychoanalysis helps people work through unconscious conflicts that are thought to underlie anxiety disorder, whereas more modern psychodynamic approaches also focus on current disturbed relationships and encourage clients to assume more adaptive behavior patterns. And so it's important to note that as much as this still deals with somewhat the unconscious, it is an opportunity for people to go through talk therapy and help better understand how their past might affect their current life, let alone their future. Now, humanistic theorists suggest that our anxieties are a result of the social repression of our true inner selves. Anxiety stems from the incongruence between the true inner self and the presenting social self. And so, as the image seems to suggest, the cat seeing themselves and projecting themselves as a lion, the true self is that they're a cat, but the social self they project might be something different. And it's that incongruence that humanistic therapy aims to get in touch with, and enabling us to be more in touch with our genuine self, to know, to accept, and to be our authentic self. Now, it's quite possible the cat truly believes that the inner self is a lion, in which case maybe that cat is truly aligned. Carrying on. Well, now we can look at a more biological perspective, which has spawned the development of various drugs to treat anxiety. Antidepressants has an effect on anxiety. In addition, it also affects depression, as the title would suggest, but it affects anxiety by normalizing the activity of neurotransmitters in the brain. Normalizing meaning it either diminishes what is an overactive one or excites what is otherwise an underactive one. More recent success with the serotonin norepinephrine uptake inhibitor, also known as SNRI. Obsessive compulsive disorder responds better to selective serotonin reuptake inhibitors, or SSRI, as it assists with the serotonin transmission, possibly responsible for the development of OCD. Now again, this is not absolute. This is really just speculation and theory, but it is through trial and research where they're trying to narrow down what in fact has the best impact. Now, drug therapy is not a one-size-fits-all, and it will do better in conjunction with cognitive therapies. And so it's not usual that the one drug solution will work for everybody. Now, as an alternative, as mentioned, cognitive approaches, they'll be using such things as rational emotive therapy and cognitive therapy to help people identify and correct the cognitive errors that give rise to or maintain anxiety disorders. The cognitive behavioral approach to treatment of panic disorder help people with a proneness towards panic disorder to learn to cope more effectively with cardiovascular and other bodily functions. So, for example, the cognitive approach would begin with identifying the self-defeating thoughts. This is the cognitive approach would be thinking. So once we could identify what thinking is perpetuating our anxiety, stimulating our anxiety, or maintaining the anxiety, we can then start to generate rational alternatives, not ones based on the irrational thought of some elements of anxiety. They're based in something rational but exaggerated. So we find the rational alternatives and we replace them, and we get to a place where the person can start to accept the rational alternatives and repeat them. In fact, it's gone through a lot of repetition and practice, rote practice, that can help, for many people, build up the skills required to handle the bodily sensations in a more adaptive way. Now, cognitive and biological and psychodynamic are not the only approaches. We'll look at learning and behavior-based approaches. And learning-based approaches encompass a broad range of behavioral and cognitive behavioral techniques to help people overcome anxiety-related problems. Now, exposure methods help people with phobias overcome fear through gradual exposure to phobic responses. And we'll use desensitization and gradual response. And you see this chart that if we're looking at improving our ability to handle a fear we have about spiders, not that everybody feels they need to do that, we would use desensitization and gradual exposure. So you move from thinking about a spider and looking at a photo of a spider and move your way to being able to have a spider on your hand or on your arm. Now this is organizing exposure using the fear stimulus hierarchy. And that's what the chart there is representing. That's gradual exposure. You'll see more of this if you read on pages 129 to 131. Now, obsessive compulsive disorder is often treated with a combination of exposure and response prevention. And relaxation training is used, as well as behavior treatments for PTSD or post-traumatic stress disorder. And we'll look at those here on the next slide. So social anxiety is often using gradual exposure and flooding. Now, gradual exposure from less to more stressful associations. There's a gradual exposure from that until there's until the urge to escape those social environments subsides. The therapist will often guide the client at first, and then the client learns to self-talk with more rational and healthier responses. If we look at agoraphobia, again, gradual exposure has had good and enduring success in treating agoraphobia. Now, if we look at obsessive compulsive disorder, a gradual exposure and response prevention, the expression of effort to now this is what response prevention is, the expression of effort to physically prevent a compulsive behavior from occurring. Now, the physical ability to prevent it is, once the thought enters as an obsessed thought, the behavior tends to follow, and it takes effort to stop it or to ward it off. And this is repeated and repeated, and it has minimized the anxiety associated with OCD. Now again, this is not a one-size-fits-all, and it doesn't apply and work with everybody. Some need different combinations of therapies. The cognitive behavior treatment for generalized anxiety involves using relaxation techniques and substitution. Substitution of adaptive thoughts for intrusive thoughts and anxiety-inducing ones. And they will also use decatastrophizing. This is basically strategies used to avoid thinking the worst can happen when in fact there are things between the best and the worst. So if we took a closer look at coping with panic attack, there's a few things that people are often recommended to use in both learning and cognitive. Don't let your breathing get out of hand. Now the 5-5-5 is just representing a breathing technique around inhale to the count of 5, hold to the count of 5, exhale to the count of 5, repeat 5 times. And what you're doing here is you're putting your concentration on the counting to 5, holding to 5, exhaling to 5, that takes your mind off what you're immediately panicked about, and it also starts to oxygenate your system. When one gets into a panic attack, you tend to get into shallow breathing, and shallow breathing means you're taking in less oxygen. Less oxygen alerts the brain to panic. So 5-5-5 enables you to breathe, relax, or at least try to get to that state. Some people find the benefit of breathing into a paper bag as being helpful to sort of reduce the effects of panic attack. Talk yourself down. Think positive thoughts. Try to relax as best you can. Breathing is a good strategy. Find someone to help you through the attack. Don't become housebound. Get out of the house, move around, get some fresh air, get some sunshine. And if you're uncertain about the physical sensations, seek medical advice. So what we've looked at in this particular video is looking at some of the treatments associated with anxiety disorders. I hope this has been helpful. Keep up the good work and keep checking out your textbook and making notes. Good luck, everybody. Bye now.